A good one in store for you. I'd like to welcome my first guest, Dr. Zwetchkenbaum. Thank you.
Nice to meet you, Kate.
So much for coming in with the Rhode Island Department of Health, the director of the dental program there. Just got some really good numbers for national rankings, didn't we, about the state of oral health here in Rhode Island?
Right. So Oral Health America comes up with this biannual report, A State of Decay, and we rank number 7.
State of decay. So you don't want to have a big state of decay, but it's a top 10 ranking. How did Rhode Island manage to do so well in this ranking?
So they looked at 6 things. One was our severe tooth loss rate among older adults, which is decreased. For example, our edentulous rate, so that's your new word for the day, went from 25% of people over 65 in 1999. It's now at just 12%.
Wow, cut in half.
Yep. Utilization of dental services by older adults, the fact that we have a high rate of community water fluoridation, our state has a state oral health plan, and what else? The basic screening survey was done of older adults.
So what do you attribute that huge drop-off of those older individuals going from that 25% number down to that 12?
I think greater utilization of dental services, community water fluoridation, awareness of the importance of oral health, and hopefully, the big one is hopefully dietary changes.
Okay.
But again, the other thing I should say is with a reduced edentulous rate means there are more older adults who are keeping their teeth, so they need to be aware they have to get those teeth taken care of.
And how does, from the dietary standpoint, when you're talking with older individuals, did dietary factors play a role?
Well, one of the things we say is if you sip all day, you get tooth decay. So if you have sugar, it makes your mouth acidic. And there's a certain bacteria called Streptococcus mutans. Streptococcus mutans loves an acidic environment. It converts the sugars into more acid, which then demineralizes the teeth. So if you're going to have something sweet, which I have a lot of sweets, just have it maybe at one time during the day.
Okay, so keep an eye on that sugar intake. So this number 7 ranking, can we get higher? So what does the state continue to do to address oral health needs in the state?
I think, again, to make sure we have a robust adult Medicaid dental benefit so that older adults have access to care. I think communicating with older adults and increasing their oral health literacy, making them aware of the need to get preventive services. Because what happens is when people turn 65 and they lose their work-related dental benefit, they may stop going to the dentist. So we need to raise awareness that even if, ideally they'll have a dental benefit, but if they don't, if they can spend money on preventive services, it's better for their teeth.
Any concerns from a funding standpoint as to how things look for Medicaid and where these dental dollars may be or may not be?
I think in the future, I'd love to see sort of an integration of medical and dental, that the medical insurances realize that if they put more money into dental, that it'll save them money on the medical end.
It's not just auxiliary, it's complementary.
Yeah, exactly. And again, the whole medical dental integration things means educating physicians to ask each patient when they come in, have you been to the dentist? So I was very fortunate. I went to a physical recently and my physician did ask, have you been to the dentist? But not all physicians know to do that. So we need to educate the whole medical community that the mouth is actually part of the body, and if they make the referral, that'll help.
Again, that number 7 top 10 ranking, though, is good for the state of Rhode Island as to what we've been doing.
Yep.
And again, not that we need to get to that top mark, but what should folks be aware of when they're watching the show right now as to the role, again, that the Department of Health plays?
Well, again, I think our big role is to try to educate the public, assure that we have evidence-based preventive modalities in place, like the community water fluoridation. There are still communities out there that don't have fluoride that we can help. Again, raising older adults' awareness that as they age, they have more dental issues, part of it having to do with medications and dry mouth. So I don't know if you know, but saliva is nature's magic potion for keeping your mouth healthy. And if you don't have enough saliva, you're at increased risk. So you may need to go more to the dentist. So I think the Department of Health needs to help raise awareness among older adults and also medical providers.
And you talk, again, the focus being on older Rhode Islanders. I mean, we do have the aging baby boomer population. What's your take on regular adults and children in dental health?
We are very fortunate. We have high insurance uptake for children because of our Right Smiles program. So 97% of kids have dental insurance. I'd like to see more of them going, so we need to, again, educate parents and physicians to refer. Sealants are a very important preventive measure, and if we can increase the number of kids that have sealants, also if we can increase the number of kids who get fluoride varnish either at the dentist office or at their physician. So physicians can actually now apply a preventive fluoride. Ideally, we want to reduce the number of kids with early childhood caries or tooth decay.
So when did that happen that they started having physicians on the fluoride side of things?
2009. I actually had to fill that out. It's not like I normally know that. I had to fill out a questionnaire today. But yeah, in 2009, we helped physicians learn that while they're seeing a kid, because not every kid is immediately going to the dentist.
Yep.
So I'm talking about, well, I'll ask you, when do you think a kid should first go to the dentist?
When they've got teeth coming in.
Right, perfectly. So age 1. But we didn't always know that. We always, 3, 5. But age 1 is the recommended dental visit. And at that point, physicians, or if they've finally got a dental home, they can apply the fluoride varnish.
And again, because they have them right there, they've got the captive audience, if you will.
Exactly, yeah.
And let's just talk about the science altogether. It's 2018. Have we seen any advancement sort of in the dental arena that we see played out in the sort of either average doctor visit or more advanced measures?
Well, I think hopefully dentistry is moving from totally surgical, doing, drill and fill, to a more medical field. And again, using those fluorides. Well, first we need to do a proper risk assessment for each patient, because everybody's different, and then based on their risk assessment, give them the proper fluoridation that they need to actually reverse the decay. So I think that's probably the biggest advance.
Getting to knowing that exact level, because it sounds like it could have too much or too little.
Yeah. I mean, I don't think there's usually a concern, unless somebody wants to swallow it excessively, but there's actually, so my mother, for example, went on an antihypertensive that dried her mouth out. So I knew that she was at increased risk of tooth decay. So I prescribed her a 5,000 parts per million toothpaste. Normal toothpaste is 1,000 parts per million. And the data actually shows that reduces her risk of root caries. But not every patient knows that. Not every patient has a son as a dentist, but we need to make sure that physicians are educating the patients. Or even, what if the pharmacies started educating patients? You just got a prescription for this. It's going to dry your mouth out. By the way, you need this.
So have that secondary, exactly.
So I think that medical-dental integration is also something that's fairly new.
Well, again, because sounds like we are in 7th place here with the most recent rankings for things that we've been doing here in the state. What do we expect to see from the Department of Health in the coming year?
Well, I think we're going to be, we just actually applied for some grants where we want to do things to improve access to care for vulnerable populations.
Okay.
So we have a new worker in the workforce called a public health dental hygienist. These are dental hygienists who can go to alternative sites such as nursing homes and provide preventive services. So they don't need to wait for the dentist to do an exam. They can go ahead and provide a cleaning. So that's something pretty exciting. So been working with CCRI on an educational program, and I guess, and possibly working on something called teledentistry, which would allow the public health dental hygienist to do an exam, send some pictures back to the dentist so that they can give some advice and treatment recommendations.
So incorporate a little technology into it as well.
Exactly.
Well, very good. I'm glad that we were able to get you in here, give folks sort of a state of the state, if you will, of Rhode Island dental health and where things are at. We'll provide a link to that study, that state of decay, that Rhode Island does rank 7th for oral health here. So appreciate, Doctor, you're taking the time to come in.
You bet. It was nice to meet you, Kate.
Okay, don't go anywhere. We'll be back with our next guest here in the Navigant Credit Union Broadcast Center.